CBT stands for cognitive behavioral therapy. This theory states that we have a set of beliefs. These beliefs influence our thoughts in response to any given life situation. And then from our thoughts, we have certain reactions. Our beliefs are developed mainly through our past experiences, but are also influenced by our genetics, our environment, and our culture. You can tell what your core beliefs are by filling in the blanks. I am, and then just fill in the blank. Other people are, and the world is. You can have core beliefs about anything. My health is, food is. So it's basically your overall belief about any given broad topic. And so from these beliefs, we also develop conditional assumptions about life. If I do this, then this will happen. And so CBT looks at our cognitive processing and determines what are the patterns. Are there any thinking distortions? And if so, then we do something called cognitive restructuring or reframing to correct this distortion. The thoughts then trigger reactions. And so our reactions can be internal. They can be an internal emotional response or a feeling. They can also be an internal physiological response, such as your heart racing or feeling butterflies in your stomach. The reaction can also be external. That can be a behavior such as yelling, crying, or fighting. And a physiological external response would be sweating. And so when someone has anxiety or is insecure about their life, they tend to overestimate the risk of negative outcomes and they underestimate their resources if the negative outcome were to happen. And so through CBT, what we do is we first of all, develop an understanding and a self-awareness around what the distortions are and what the negative, possibly negative core beliefs are, what the negative thought patterns are. We help the person develop some awareness around that. And then we start with a process of exposure to new experiences where they can learn to tolerate this risk of uncertainty and to notice when they reach for their resources and to encourage them to practice reaching more. So once they have enough exposure to new experiences that tell them that, even when the risk is high, that they have resources and they're able to reach for them, then they start to develop new core beliefs. So whereas an old core belief might be, I am unsafe, because all of their past experiences have told them that, the world is not a safe place, then they can develop some awareness around that and to see where they may be using thinking distortions, such as maybe excluding information that tells them the world is a little bit safe and overvaluing or overgeneralizing ideas that tell them the world isn't safe. So once they notice this pattern, they can start to have new experiences where they begin to notice that the world is safe sometimes, and they also learn to tolerate the uncertainty and the risk when the world isn't safe.